Thank you to our listeners for being with us again on another episode of the Healthcare Leadership Excellence Podcast. I just can't wait for today's guest to get going here, so I'll be brief. We've got a author here of Hacking Healthcare, then another book that he's writing on Healthcare Nation, The Future is Calling. Former senior director of GE Healthcare, executive at Microsoft, directing their AI for Health and Sciences, noted as featured in Forbes, CEO Magazine, HBR, noted as one of the top 20 voices in 1924 for this topic we're going to be talking about today. So we just feel really, really fortunate here at the podcast to welcome Tom Lawry with us today. Tom, thank you for being with us.
Well, Carl, first of all, thank you for having me. I think you left out my job as a paper delivery boy when I was 14, but you seem to have covered everything else. So thank you for that.
A fundamental point. Oh, good. And our listeners are going to hear today that we also have a great sense of humor with us. So, Tom, just give us a brief trajectory of what brings you to really an internationally renowned voice for some of the things we need to look at in healthcare, including good leadership. So give us just a brief background of you.
Well, you covered a lot of ground there in the introduction, but essentially, I've been in and around healthcare all of my life. I was very fortunate. When I was 24, I got a job as a junior executive at a 500-bed hospital here in America. Spent 12 years in healthcare management. Then I crossed over to the dark side of technology a long time ago when the dot-com era began. And basically, I kind of crossed over because I saw the promise and the hope of being able to use things like digital technologies to improve healthcare in general. So spent 7 years doing 2 venture-backed startups, and then had the privilege of working for, I think, 2 of the best companies in the world, GE and Microsoft. My last role at Microsoft was National Director for Artificial Intelligence specific to health and life sciences. As part of my various roles at Microsoft, I spent 15 years basically working in the area of analytics, including AI, including a role where for 6 years, 80% of my work was doing that outside the United States. So I've had the privilege of working with great clinicians and leaders around the world on analytic projects in AI. And that brings us to where we are today.
Super. So I'm going to jump in. I read on one of your background sheets a statement that just was staggering to me, and it may be that I'm just not familiar with this area. The first question I have as we developed, and again, to our listeners, Tom and I had a great prep session of just thinking what would be the best questions, what would best help him teach us. And the question is, how is America's healthcare not performing? But I want to add in a note here. If you are a citizen of Mississippi, you probably won't live as long as someone from Bangladesh. A bit about that.
Yeah, well, what you're referring to is coming out of my new book, which just launched last week, Healthcare Nation. The Future is Calling, and It's Better Than You Think. So maybe bridging upon what we already talked about, where I've spent a lot of years working in artificial intelligence. A lot of promises are being made about how that's going to improve healthcare. And even if all of the promises being made about AI in healthcare were to come true, which hint they won't, even if all of those promises came true, it would make the current American healthcare system more efficient, a little less wobbly, but it doesn't address some of the fundamental issues that I believe are taking us in the wrong direction. So I'm sure many people have heard these stats before, but we spend on average 3 times more per citizen than any other developed nation in the world. And yet the statistics for things like quality, access, outcomes, and effectiveness, as measured by groups like the Commonwealth Fund, are pretty much dead last in performance. And so we have to start challenging ourselves to say, why is that? We have some of the top talent, doctors, nurses, health leaders. We spend more than anyone else. And yet the health status of our country is low and going down. To your point about the stats of if you are a resident of Mississippi, the average lifespan of someone in Mississippi is less than the average citizen in a place like Bangladesh. And yet, the richest men in America live longer than anyone on the planet. So this is a book to say we have to start looking fundamentally at what's happening. And then number two, I'm tired, frankly, of waiting for others to fix this. So how has that worked over the past couple of decades when we wait for the politicians or leaders? And so part of this book is saying, how do we help each citizen, each clinician, each leader find or refine their own voice to say, what do you think we should be doing to redirect $4.7 trillion, which is mainly your money, in quest of a better set of performance measures when it comes to outcomes and covering more people and keeping them healthy.
So a couple of questions. You noted just earlier in our recording today that not all the AI promises are going to, actually happen. Tell us some of the AI promises in healthcare that we can look forward to happening, and some of the ones that really, as a former national director for Microsoft on this topic, that no, probably not so much. Give us some insights on that.
Yeah. Well, it's interesting to me how for years I toiled in anonymity. If I was at a cocktail party a few years ago and someone said, "What do you do?" and I said AI in health, they'd go talk to someone else. And then in the fall of 2022, when things like ChatGPT and Gen AI and large language models came screaming at everyone, as we rolled into the spring of 2023, it was interesting to me. AI became such a hot topic that now everyone seemed to be an expert, whether they had worked in it or not. So, to your question, the one thing that I always like to talk about is, and if you understand this, it becomes your decoder ring. AI only drives measurable value by doing one of two things. It either automates the way work is done or it augments it. In the case of automation, think about manufacturing where there's a very fixed standard process. There's one thing that's done 1,000 times exactly the same way. That's automation. When you look at healthcare, the majority of work done, whether it's clinical or operational, are done by knowledge workers. So these are places where it requires a lot of things like problem solving and creativity and experience and wisdom. This is the situation where, done right, AI is brought in behind those knowledge workers to make them better at the things they care about. So specific examples today are things like, we're seeing a lot of uptick on things like administrative efficiencies, or being able to, if you're a healthcare provider, use AI to figure out which claims you're about to drop are going to get rejected, which means it takes you more time and money to collect. On the clinical side, we're seeing a number of things, including some of the early use cases around things like being able to, if I'm discharging 100 patients today, I can predict which ones have a higher likelihood of coming back on a preventable readmission, so I can start putting my resources into making that not happen, which improves quality, improves operational performance. A lot of work on clinical decision support, not to, once again, replace the opinion, the views, the experience of the clinician, but rather aid them in making better decisions. And then if I take it just a little farther, we're starting to see, and particularly outside the United States, AI being used to drive population improvement at scale across countries. So I was just in Asia Pacific recently. The country of Singapore is using AI and what's known as nudge theory to help slow the progression of citizens who are pre-diabetic moving towards full diabetes, which is a health improvement. And if you're the government of Singapore, and you know that once someone crosses over to full diabetic, that citizen costs you an additional $8,000 a year for as long as you're alive. So done right, it's everything from operational improvements to really getting behind, not replacing, getting behind doctors, nurses, and others to make them better at the things they care about, and frankly, we as consumers care about.
So, as we mentioned on the pre-call, the whole purpose that we have behind this podcast, Tom, is helping the nurse manager, the new physician leader, to get out of the car at the hospital or at the clinic this morning thinking, wow, what Tom said really resonated, and I can do this today, because you talked about, how to develop this new way of thinking. We've got to start thinking about things differently. So dive in a bit on what new discussions do we need to be having at the grassroots level
Yeah.
in order to start using some of your ideas here.
Well, Carl, I know a lot of your focus is on leadership, on transformation. And so, we could spend many hours discussing that. But what I would say is it starts fundamentally with leaders, particularly C-suite leaders, and how they approach AI. And one of the first things I do in my advisory work is assess where they are. And in a simple way of looking at it is if leaders are seeing AI as a technology play, where it's an initiative. If I ask a CEO or a C-suite leader, tell me about your AI program, and they basically portray it as a technology play, that's going to play out very differently as it cascades throughout the organization than if they understand that done right, and I'm always going to emphasize done right because many times it starts out being done wrong, but done right, leaders recognize that AI is not about technology, it's about empowerment. It's about saying, how do we take this technology and have it help improve things like clinical and operational workflow? When you start looking at it from that perspective, then you start factoring in things like, design thinking, things like Six Sigma and lean planning. I had a situation a few years ago with a very large healthcare provider organization that I was just coming into, and they were treating it as a technology play. And it was interesting to me because I asked a simple question of, well, do you have anyone who like is Six Sigma or lean on your staff? And they very proudly said, we've got a whole team. When I asked the question of, are your people who really understand process redesign part of the AI team doing the planning and deployment, the answer was no, which once again, if you see it purely as a technology play, your ability to drive value scale across the enterprise is going to be very different than if you see it as a way of empowering all of your knowledge workers to start making changes in how they work.
So for the frontline people, because certainly the C-suite has to be the frontline leaders and providers can do, because I don't think there's anyone out there that isn't rocked a bit by the Mississippi example, the example you give also about our maternal and childcare concerns. What can the frontline person do that can start a change?
Well, a very piercing question, and let me try and parse the answer, because they're the things that AI can do, which gives us the ability to rethink existing ways in which we work to make them more efficient, to make them less burdensome for the hard-to-find clinical workers who are in short supply and we're burning out because of these fundamentally flawed processes. To go to that next level, which is a big part of my new book, it's like, how does each person find or refine their voice for what they think should be done? So at the macro level, here in America, most of healthcare operates on what I call a break-fix model. Healthcare only makes money when you are sick or injured, and then we get to do something. So 97% of that $4.7 trillion goes towards the break-fix model. Only 3% of that money goes towards prevention and preventive services. So I'd capstone that by saying in America, 30 million people every year die from preventable diseases. Think about that. Preventable. So the question becomes, and it's not what I think, it's what every listener thinks, it's what those frontline people think of. Does that make sense? We spend more than anyone else, but 97% goes to, we wait until you have diabetes. We wait until you have some diet-related condition. Only then do we respond versus what if we could do more to prevent or slow the progression of some of those things from happening to you, to your family, to people you care about? And that's a fundamental question that has nothing to do with technology and everything to do with how we as Americans today invest all of that money.
Absolutely. So one of those fundamentals is what you just looking at in healthcare at a micro and macro level.
Well, I think it's both. I think you started the discussion where here in America, maternal mortality rates for all women are worse than most third world countries, number one. Number two, what is even more perplexing, and there's no data or science that explains this away, is Black women are 3 times more likely to die at childbirth or of childbirth-related causes than white women. There's no scientific data that explains that, number one. Number two, that statistic, by the way, is worse today than we as Americans began keeping records in the early 1900s, which was not exactly the halcyon days for either women or Black Americans. But these are the questions around the data. I mean, this isn't my opinion. This is data that shows what's happening to health status in general, and then the health status of specific populations like Black Americans, like women. And so those are the issues I'm raising in the new book. And it's not what I think. It should be about what everyone thinks and views of, is finding a resolution to maternal mortality rates something that's important. There's a lot of data, and I cover it in my book, where women's health, there are very strong underperformance in women's health issues compared to how we care for men, from what we do on clinical research to what we do to access to preventive services. So these are all the issues that are more of a societal discussion rather than a technology or medical debate.
Excellent point. So how do we restore? Let me rephrase. From my experience in working with hundreds now of medical professionals and healthcare administrators, no one went into this profession to have it deliver what you describe it currently delivering. I mean, no one showed up thinking that they're going to have such horrible outcomes as some of the data suggests. From your view, not only as because I see you as a person expert in technology, but you also, traveling the world, almost have a sociologist view of what's going on. So how can we restore the environment that people came into the profession wanting, but seems to be struggling? Thoughts on that?
Well, as I mentioned earlier, I got my first job in healthcare when I was 24. I think it's a very noble cause, and I think particularly in America it needs our help. But I've had the privilege of working around the world, and whether it's a neurosurgeon in Charlotte or an herbalist in Beijing, I've never met anyone in healthcare who doesn't believe it's a noble cause and they want to be part of, doing the right things. I have a chapter in my book titled "Healthcare is America's Largest Escape Room." So think about it. We've taken some of our very best clinicians and health leaders, people with very good intent, great training and background, and we've put them in with consumers and $4.7 trillion of our money. The problem is we haven't figured out how to escape from, the convoluted policies and the very wacky financial incentives that drive even the best intentioned people and mission driven organizations in the wrong direction. And that's the discussion we need to start bringing to the forefront. And it's also the discussion that we shouldn't be waiting for others to start. I was interviewed by a very large newspaper in London last week that's frankly kind of a tabloid, but they kept, bringing it around to asking me what I thought about RFK and RFK's views. And my point is, if RFK's a lightning rod, fine, but it shouldn't be about what RFK or anyone else thinks on food or chronic disease. The good news is, here's someone that's teed up two important issues for Americans: what's happening with food and health, and what's happening with chronic disease. It shouldn't be what he thinks or any elected official thinks. It should be, what do we believe we should be doing? How do we take this tremendous talent base and all of this money and start reimagining and redirecting on what we truly feel like we should be doing on chronic disease, or we should be doing on diet-related health issues? And so some of this is the call where I think so many people feel it's what I call healthcare fatalism. The problem's so big, the system's so complex. Many people say, well, what can I do? And to me, it starts with, having a voice, having an opinion, having a view, because when enough of us say we've had enough, that's when everyone else inside the Beltway will start listening.
So a couple of notes that I took in our pre-call that I think fit in here. When you talked about harnessing the angst and the anger, is that what you're referring to here? That when enough.
Yeah, I mean, there's lots of data that shows, there's one study that shows 70% of Americans feel like the health system's failing them. You and I talked about, the tragic situation late last year with the assassination, the cold-blooded murder of the CEO of United Healthcare on the streets of New York. If that wasn't tragic enough, the response online from everyone who frankly celebrated, this act of violence because this person was the head of a healthcare organization speaks volumes to the angst and anger so many people feel. And I'm not in any way justifying that, but I was in Australia recently working, and I was having dinner with a group of clinicians and others, and they were talking about the limitations of the Australian health system, where healthcare is a right. And I asked a simple question that I think at first they didn't understand. I asked the question of, how many Australian families declare bankruptcy because they get sick? They couldn't even comprehend the question. In America, the number one reason people file for bankruptcy is not because they go to Vegas, it's not because they live lavish lifestyles, it's because they or someone they care about get sick.
Where do you see that trajectory going? Do you see it improving? Do you see it worsening? Any predictions there, Tom?
Well, I'm a data person. The data shows, for example, even though many research studies show investments in public health produce a multiple on return, currently in real dollars, our investment as a country in public health is going down. Back to the current administration, which I'm not making any political statements, but there's a lot of questions and talk, and I think that's all worth watching. But I also think it gives us the impetus to say, let's stop waiting for someone else to tell us or figure out what to do. And if each of us, no matter where you are, again, you're a doctor, you're a nurse, you're a healthcare leader, you're a citizen, you're a Medicare recipient that just went through an experience, your ability to start thinking from a common sense view of what do you think the system should be doing to take care of you and people like you is the debate, is the discussion we need to start raising to a higher level rather than waiting for someone else to tell us what they think should be done.
And I think this ties into another note I have here. Is this the medical blame game that you refer to?
Absolutely. And I think that brings us back to, the tragic situation with the CEO of United Healthcare. Part of the dialogue we've had, I mean, think about for the past several decades, the debate that always happens inside the Beltway with congressional hearings, it's all about what I call the blame game, where it's like, this month we're having hearings and we're going to, truck in the pharma execs, and all of a sudden they're going to be the bad guys. If only we could, reduce farmer prices, then would fix the system. And then the next month, they bring in the providers or the payers. And, for all of the pageantry, it is just that, it's pageantry. None of that on its own will fix things. And to me, those are symptoms. And just like, I'm not a doctor, but when you treat symptoms rather than going after root causes, that usually doesn't produce a good outcome. I think, the famed news broadcaster from a while back, looks like the two of us will remember Walter Cronkite, but Walter Cronkite, I think, nailed it when he said, the American healthcare system is neither healthy, caring, nor a system. And to that point, I bring it back to we're burning out the very doctors, nurses, and others who are in short supply. The system itself is doing that. We're causing harm to those people. Our performance measures for the system that we're asking those people to work in clearly shows it's not working compared to every other developed nation, particularly for the investments we make. So that's the conversation we start having. How do we liberate those clinicians, free them up to pursue all of the things they say, that they went to medical school for? And one final point, one study back to AI, one study from McKinsey suggests that up to 30% of all activities done by doctors and nurses could be automated with AI. These are not the high-level things they went to school for, they have experience in. These are the repetitive, low-value activities that are contributing to their burnout. So imagine if that were to come to pass and we could go to our clinical staff and say, what if I could give you 30% of your time back by eliminating the things that you grit your teeth on? How would we then reimagine what to do with that time? These are all of the things that are in the realm of possibilities, back to what you were saying earlier, if leaders begin thinking and acting differently.
I know we're coming on time here, but I have one more question around a note that I took in our pre-call. And you said simply, we have to stop wounding the heroes. Talk to me about that a bit.
Again, I'm a data person. So, let's go back to when the first wave of COVID hit. The system, system preparedness in every health system in America is always something we tout. No one was prepared for what came. Providers, doctors, nurses, others stepped in. They basically kept the system going. When that happened, we were burning them out in record numbers. We were forcing them to do all kinds of things. And back then, we called them heroes. And we said, let's get through this. When we get through COVID, we're going to fix this thing for workforce burnout. Fast forward to present day. The data shows we have a bigger problem with workforce burnout among our doctors, nurses, and clinicians than we ever have, including in the heights of COVID. So, we have 70,000 Americans turning 70 every day, which normally means they're going to use 3 to 4 times the amount of resources as those under 70 or 65. Meanwhile, we have nurses and doctors retiring or moving on in record numbers. The data shows today we're going to be nowhere close to having the right kind of caregivers in the next decade when it comes to, the supply of caregivers and the demand being generated as all of us get older. So one, it says we've got to do things differently. Two, if AI can in fact be of assistance, not replace, but augment, make them better, Those are all of the conversations we should be having, all of the issues that should be on the table.
So, in conclusion, I want you to spend a little time with us here, Tom, on your two books. Hacking Healthcare came out 3 years ago, and now coming out just next week is your newest one on Healthcare Nation.
Yeah.
Talk to us just briefly about those.
Hacking Healthcare was my second book on the application of AI to transform healthcare. So, I was very pleased. It was named by Amazon as a bestseller. And it's just, it's a book about, it's not a book for techies. It's a book about anyone being able to look at and understand what AI is and how it can be applied to do measurable good in healthcare. As I mentioned earlier, my new book, which just came out, is not about technology because the technology won't address the underlying issues faced in America when it comes to healthcare is not a right, the break fix model, I'll just call it the wacky ways in which doctors and hospitals and others are paid. And, there's data that shows, providers are paid 82 cents on the dollar for what it actually costs them to take care of a Medicare patient. And then God bless the finance experts who somehow figure out how to swizzle that and shift those costs to others, including you, if you're paying. I mean, is that a logical way of running healthcare in America? I don't think it is, but again, it's not about my opinion. It's about everyone else's opinions to say we have the ability to reimagine healthcare in America, which is the subject of this new book.
Excellent. Anything else, Tom, that we haven't covered that our listeners need to hear from you?
Well, I would just say for anyone actually in healthcare, God bless you for what you do. It's a challenge. I have the privilege and ability to work with a lot of people here in America and around the world. I just had a call today with the nursing leadership of a major organization here in America. And, I think of all of the groups impacted when it comes to AI, I think nurses will have more impact on the way they work than even doctors. But again, I turn that around to say our ability to harness the wisdom, the power, the experience of these clinicians, let them help drive what's happening in AI. That to me is part of the revolution that could be very positive for them and for those they serve. So I would just say, for all of you out there working in healthcare, thank you for what you do. Our ability to make it better, to get you out of the box we've put you in, has a lot to do with how we utilize technology and then how we start reimagining and redirecting our investments in healthcare.
Tom, thank you so much. This has been superb. I just go to the point. One of the major tech companies has as one of their taglines, think different. And I think today, if anything we pull out of this is there's so much we can accomplish if we start to think differently. And thank you for being such a voice on that very topic. So thanks again.
My pleasure, Carl. Thank you for having me on.
Absolutely.